However, we have had challenges in our blood collection, and we have been recording about a collection of about 164,000 pints a year over the last couple of years, which translates to around 450 pints a day. So you can see we are far short of the minimum that we should be doing, and there is a need for us to work towards achieving that minimum. With the COVID pandemic, as has been seen globally in many other areas, many other parts of the world, because of the restrictions and the containment measures that have been put in place to combat COVID-19, it has been recorded that those seeking health care have also gone down. The rate of people going to hospitals for care and for other services has gone down because of this abnormal situation. And this is something that is not unique to our country, but has been recorded everywhere else. If we look at blood collection during this period of the pandemic, it is estimated that between 70 and 80%, there has been between a 70 and 80% drop in blood collection during this pandemic year times in many parts of the world. We in Kenya have recorded a drop from the 450 pints a day to about 250 pints a day. So the launch of this campaign is extremely important because we need to increase the number of pints that we collect in a day. And you will all are very well aware that we have faced challenges as far as our national blood transfusion services is concerned. Challenges that as a ministry we are diligently addressing in order to improve service delivery in this sector. Recognizing the need for additional investments in this sector, the government has initiated a number of programs to be able to build up the capacity of the Kenya National Blood Transfusion Services. We have increased the number of human resources within this facility by posting an additional 22 members of staff to the Kenya National Blood Transfusion Services. We have also arranged for additional resourcing of this facility, and we will be pumping in about 1 billion Kenya shillings through a World Bank program in the coming months to upgrade and improve the level of services, the level of blood collection within all the satellite sites and sites that collect blood under the Kenya National Blood Transfusion Services throughout the country, to ensure that we have enough commodities that are required for blood collection, that is the blood bags, and everything else that is required for that supply chain, and also to ensure that we have the right equipment and reagents that are required in the lab to ensure that the blood we collect is properly handled, processed, and is safe for transfusion to patients. So that is ongoing work, and we, including, as I should add to, including looking at the governance structure of this very important service sector with a view of improving that through legislation so that the National Blood Transfusion Services can become a semi-autonomous agency that will be able to function with some level of autonomy and hopefully effectiveness and efficiency. These are all plans that are in the works, and I'm sure that in the next coming months we should see some activities in that area, even though the COVID-19 pandemic situation, of course, as you will all agree, has slowed down a number of activities. So, ladies and gentlemen, as part of effort to appeal to our people to volunteer and donate blood, we have also collaborated with partners, leveraging on the importance and utility of ICT in service delivery. We have collaborated with Facebook, for example, and Dawa Sasa Systems, who use their ICT platforms to mobilize blood donors for the next two blood donors for blood donation campaigns such as this one. For this particular campaign, I can tell you that as of this morning, about 12,779 individuals in the country had set reminders on their Facebook accounts to come out and donate blood countrywide. There are also 33 other centers countrywide where this same exercise that we are conducting here today is also being carried out. Another 1,522 people who have called various centers to book an appointment for blood donation are expected also to present themselves and donate blood at these centers. We want to appeal to those inquiring and making pledges, as well as other well-wishers, to come forward and participate in this very important activity. Must also say that we are grateful to our partners and sponsors who have extended their hand of support in this venture. We want to express our appreciation to the Kenyatta International Conference Center management team for allowing us to use these wonderful grounds for this campaign, the Standard Group, Dawa Sasa Systems, UNFPA, AMREF, Farm Access, Kenyatta National Hospital, and Coca-Cola, who have all played a part in organizing this drive. Let me now move to our business of the day, which is to bring to you our report on COVID-19. Ladies and gentlemen, I am delighted to inform you that today we have discharged 72 patients from various hospitals who have recovered from the disease. This brings to 1,164 the total number of those who have so far recovered from COVID-19. This is good news. I think every time we see good numbers of recoveries, it's good news for us because it shows the balance between those that we are confirming positive and those that we are discharging. Remember that this is an in and out process, so the more we discharge, the more we will be able to handle as if our numbers rise. But it is also a clear indication that COVID-19 disease is not a death sentence. You can get COVID-19, you can recover, and you can move on with your life. To overcome this disease, it is very clear that we have to follow and adhere to the advice that is issued by the Ministry of Health. As we have said repeatedly, to beat coronavirus or COVID-19 disease, we need to be able to contain it, and the containment measures of hand washing, social and physical distancing, wearing masks, avoiding large gatherings, staying at home when you can, and minimizing any situation where you will be interacting with others. Those are the key measures that need to be observed in order to break the cycle of spread of this virus. Now, when we come to testing, today we have tested 2,000, over the last 24 hours, 2,419 samples. bringing to a total the number of tests that we have so far conducted to 108,666. Of these 2,419 samples tested over the past 24 hours, 90 have returned positive for the virus. And this number now brings the total number of COVID-19 positive persons cumulatively to 3,305. All the positive cases are Kenyans. 62 of them are males and 28 are females. The youngest is 14 years old and the oldest is 80 years old. These 90 cases are distributed in the following counties. Nairobi recorded 36, Mombasa 34, Busia 12, Uasin Gishu 3, Kilifi, Garissa, Kisumu, Meru and Turkana 1 each. By sub-counties, the Nairobi cases are from the following areas: Kibra 12, Makadara and Mathare 5 cases each, Kamkunji 4, Langata 3, Westlands and Embakasi Central 2 each, Dagoretti North, Embakasi West and Embakasi South 1 each. In Mombasa, the 34 cases are from Mvita 14, Kisauni 8, Likoni, Jomvu, Changamwe 4 cases each. In Busia, all the 12 cases are of truck drivers at the Malaba border point. Garissa's 1 case is from Garissa Township. Kilifi's 1 case is from Kilifi North, and Kisumu's 1 case is from Kisumu Central. Meru had 1 case from Imenti Central, and Turkana 1 case from Turkana West. Unfortunately, we have also lost 4 people from the disease, which now brings the total number of people who have succumbed to this disease to date to 96. We send our heartfelt condolences to the families and friends of the departed. As I conclude, I want to extend my appreciation to all individuals, groups, and companies that have partnered with the Kenya National Blood Transfusion Services in this campaign. Once again, I want to appeal to all Kenyans to come out in large numbers and donate blood in order to save lives of others. Finally, I want to remind Kenyans that we must strictly observe the COVID-19 containment measures because they are the only known modes of behavior to successfully fight the virus. And as I finish, I would also want to urge those of us who are here, including my entire team, that we support this campaign by walking over to the tents when we finish and donating blood. Thank you.
Nation, there's a lot of perceived politics, blood politics. Some people go to hospitals and are forced to part with money before getting blood. First, address that matter, and possibly what are you doing to change the attitude of Kenyans who prefer to wait until they have a relative in hospital to give blood than just give willingly?
Are you an SME looking to grow? At African Guarantee Fund, we believe in the potential of SMEs to drive Africa's growth. While SMEs make up over 80% of Africa's private sector, lack of adequate financing presents a huge barrier to their growth. Our goal is to bridge this financing gap by enabling financial institutions scale up their SME financing towards promotion of economic development and poverty reduction in Africa. Operating in over 40 countries, we have availed more than $2 billion throughout Africa, impacting over 20,000 SMEs, most of which are run by youth and women. Our commitment to empowering women-owned and led SMEs has allowed us to implement the Affirmative Finance Action for Women in Africa, AFAWA, which has a strong financial backing from G7 countries and African Development Bank. We take a strong focus in green financing through our Green Guarantee Facility, boosting the continent's efforts towards climate change mitigation and adaptation. Our very strong AA- rating by Fitch Ratings reflects our financially solid shareholders, strong capital position and proven business model, and making us an employer of choice. Partner with us today and let's drive Africa's growth. African Guarantee Fund, a guarantee for African growth.
Facility.